Ever get that, like, nagging feeling? You know, that one where you wonder if just one big medical bill could totally upend everything you've worked for in retirement?
Oh, absolutely. That's a fear a lot of people have.
Well, if that thought keeps you up at night, you are in the right spot today, because today we are going deep on something absolutely vital for a secure retirement, and that is planning for healthcare.
Could not agree more. Planning for healthcare and retirement. I mean, it's not exactly like the most exciting topic, right? It doesn't
Right.
really come up at parties,
No.
but it's so important. And understanding how healthcare works, especially as you are leaving the workforce, it is absolutely crucial for having a healthy and a worry-free retirement. And that's what we want to help you with today.
Yes, and it's easy to just focus on saving enough money, you know? Everyone talks about building that nest egg. But then healthcare costs can really sneak up on you. They can be a big blind spot in retirement.
Yeah, again?
Did you know that, like, the average 65 plus couple, they're expected to spend over $300,000 on healthcare during their retirement?
That is a huge number. And it really highlights why you just can't ignore healthcare planning. You got to be proactive.
Yeah, you really do.
Absolutely. It's not just like going to the doctor once a year for a checkup. Healthcare in retirement,
Yeah,
it's so much broader than that.
right.
And that $300,000 figure, I mean, it's a wake-up call.
So in this deep dive, we're going to cover a bunch of really important things. Navigating the world of Medicare, figuring out how to budget for healthcare, and some strategies you can use to stay ahead of the game.
Sounds good.
Yeah.
So let's start with why healthcare costs are such a big deal in retirement.
Okay.
It's more than just regular doctor visits, right?
Yeah.
What are the things that make it such a huge expense for retirees?
So a bunch of things are happening at the same time. First, health insurance premiums. They keep going up. It seems like they never stop. And then even if you have insurance, you still have to pay out of pocket for things like copays and deductibles.
Right.
Those can really add up, especially if you have any health conditions that require ongoing care. Okay, so rising premiums, copays, deductibles, and then what about long-term care? Is that a factor?
Yeah, that's a big one.
Because those costs can be astronomical, right?
Absolutely. Assisted living, nursing homes, that type of care can be really, really expensive. And those costs can just drain your retirement savings so fast.
It's those big unexpected costs that people worry about the most.
For sure.
So when you start thinking about healthcare coverage in retirement, Medicare is usually the first thing that comes to mind.
Yeah, definitely.
So what's the deal with Medicare? What do people need to know?
Well, so Medicare started back in 1965, and it's basically the main source of healthcare coverage for most retirees here in the U.S.
Okay.
I think of it as like the foundation, the starting point for building your healthcare plan in retirement.
I know our source material mentioned a couple of experts who have looked at Medicare really closely.
Oh, yeah, they did.
Who are those experts?
So there's Henry J. Aaron, he's an economist, and Gail Walensky, who's a healthcare policy expert.
Okay.
They've both done a lot of research on Medicare, how it's structured, and the challenges it faces.
Got it.
Their work is really insightful, gives you a much deeper understanding of how Medicare works, how complex it can be, and why it's so important to stay informed about it.
So Medicare isn't just one thing, right?
Right.
There are different parts that cover different things.
Exactly. Think of it as having like four main parts.
Okay.
Part A mainly covers hospital stays. So if you need to be admitted to the hospital, that's where Part A comes in.
Okay.
It also covers some skilled nursing facility care, hospice care, and sometimes even some home health care services.
Okay.
Then you have Part B. Part B is more for like doctor visits and other healthcare provider services.
Mm-hmm.
So outpatient care, preventive services, things like that, and some medical equipment.
Okay. So Part A is more for inpatient. Part B is more for outpatient.
Exactly. Then there's Part C. You might hear it called Medicare Advantage. Part C is kind of different.
Okay.
It lets you get your Part A and Part B benefits through a private insurance company.
Oh, I see.
They often include extra benefits too, beyond what regular Medicare covers.
Interesting.
And finally, there's Part D. That one is for prescription drugs.
Oh, okay. So that covers medications.
Yeah.
Got it. So it sounds like Medicare covers quite a lot, but I remember reading that there are some things it doesn't cover.
Yeah, definitely. That's a really important point.
That's crucial for people to understand.
Absolutely. Medicare is great, but it does have limitations. For example, it typically doesn't cover routine dental care. So like checkups, cleanings, fillings, those things are usually not covered.
Oh, wow. Okay.
It also doesn't usually cover routine vision care, like eyeglasses, contacts, or eye exams,
Okay.
and hearing aids.
Huh.
Also usually not covered.
Wow, that's really important for people to be aware of.
Yeah, though you've got to plan for those costs.
So if you're retired and need glasses, dental work, or hearing aids, those are all out-of-pocket expenses.
Most likely, yes.
And it's not like the cost of Medicare is fixed, is it? Don't the premiums go up over time?
You're absolutely right. Medicare Part B premiums, they tend to increase.
Oh, okay.
And based on what we're seeing now, those premiums are probably going to keep going up. So when you're making your retirement budget, it's really important to factor in that healthcare costs, especially Medicare premiums, are likely to be higher in the future than they are today.
Right, so it's not a one-time expense you have to think about.
No, it's ongoing.
It's going to keep going up, potentially.
Yeah, kind of like how the price of groceries or gas tends to go up over time because of inflation. Healthcare costs are similar in that way.
Yeah, that's a good analogy. So just like you factor inflation into your overall budget, you have to do the same for healthcare.
Exactly.
Okay, so switching gears a little bit, I remember there was an interesting fact about the Medicare card itself in the material we were looking at.
Oh yeah, you mean the quirky fact.
Yeah, the quirky fact. What was that all about?
So back in 2018, they redesigned the Medicare card, and the big change was they took off Social Security numbers from the card. It was a security measure to help protect people from identity theft. It might seem like a small thing, but it's a big deal in terms of keeping people's information safe.
That's a good move.
Yeah.
Okay, so we've talked about a lot. How Medicare works, the parts, what it doesn't cover, the fact that premiums can go up.
Right.
So given all of that, what advice would you give to someone who's trying to plan for their healthcare and retirement? Like, what are some key tips from the expert's perspective?
Well, the first thing I would say is really get to know your Medicare options. Don't just assume that regular original Medicare is the best fit for you.
Okay.
Really take the time to understand what each part covers, what's not covered, and then think about whether you might need a supplemental plan,
Okay.
like a Medigap plan, for example.
Okay, so what's a Medigap plan?
The Medigap plan can help cover some of the costs that original Medicare doesn't. Things like copays, coinsurance, deductibles. It can really make a difference in how much you end up paying out of pocket, especially if you have a health condition that requires you to see specialists or have a lot of medical expenses.
Okay, so it's like extra insurance on top of Medicare
Exactly.
to fill in some of those gaps.
Yeah. So you might pay a higher monthly premium for a Medigap plan, but you could save a lot in the long run by having lower out-of-pocket costs.
I see.
It depends on your situation, how healthy you are, your risk tolerance, that kind of thing.
Okay, that makes sense. So really understand your Medicare options. Consider a Medigap plan if it's right for you. What's another big tip you'd give?
The next tip, make a budget. A specific budget just for healthcare costs in retirement.
Okay.
I know it's not the most fun thing to think about, but it's important.
Right.
Because even with Medicare, you're going to have some out-of-pocket costs, like we talked about. Copays, deductibles, and those things that Medicare doesn't cover, like dental or vision.
Right. If you make a separate budget just for healthcare, it'll help you avoid those surprises down the road. And it'll give you a much clearer picture of your overall retirement finances.
So don't just assume you'll have enough left over from your regular budget.
Right.
Actually, set aside a specific amount for healthcare.
Exactly. Think of it as a non-negotiable expense. Like housing or food.
Got it.
And while we're talking about budgeting, it's also important to think about long-term care insurance.
Okay, yeah, long-term care, that's a big one.
Yeah, it is. The premiums can seem high, but long-term care insurance can really protect you financially if you end up needing extended care, like in a nursing home. Those costs can wipe out your savings so fast.
It's not something people like to think about, but it's better to be prepared.
Right. And, whether long-term care insurance is a good choice for you really depends on your personal circumstances. Think about your family health history, your financial situation, that sort of thing. Okay, understand your Medicare options, budget for healthcare costs, consider long-term care insurance. What else should people keep in mind?
Keep up with healthcare policy changes. Those changes can affect your coverage and your costs, so it's really important to stay informed.
Okay.
Things are always changing in healthcare.
Right.
And finally, although it might seem obvious, taking care of your health now is the best way to save on healthcare costs later. Eating healthy, exercising, see your doctor for checkups, all of that can help prevent bigger health problems down the road.
Yeah, it makes sense. It's like an investment in your future health.
Exactly.
Okay, so those are all great tips. And I know our source material mentioned a couple of maybe more unconventional strategies that people could look into.
Oh yeah, those outside-the-box tips.
Yeah, the outside-the-box ones. What were those?
One of them was HSAs.
HSAs. What are those?
HSAs are health savings accounts. They're a really great way to save for healthcare expenses in retirement if you're still working and have the option to contribute. They have some really cool tax advantages. Your contributions are tax deductible, the money in the account grows tax-free, and when you take money out in retirement to pay for qualified healthcare expenses, you don't pay taxes on that either.
Wow, so you save money on taxes 3 different ways.
Exactly.
That's awesome.
Yeah.
What was the other outside-the-box idea?
The other one was telehealth.
Telehealth.
It's
Okay.
become really popular in recent years, and it can be a much cheaper and more convenient way to talk to a doctor, manage chronic conditions, even get prescriptions, all without having to go to the doctor's office.
Oh, that's interesting.
Yeah, it's especially useful for retirees who might have trouble getting around or who live far away from specialists.
So it could be a way to save money and also make things easier for people.
Exactly. It's definitely something to consider.
Okay, so as we wrap up this deep dive, what's the main takeaway message about healthcare planning for retirement?
You just can't afford to ignore it.
Yeah.
Healthcare planning is a crucial part of any good retirement plan. It's just as important as saving enough money.
So it's not just about the number in your bank account. It's about making sure you don't have to spend all that money on unexpected medical bills.
Exactly. Planning for healthcare and retirement is about more than just managing expenses.
Right.
It's about having peace of mind. It's about being able to enjoy your retirement years knowing you're protected.
So taking care of yourself today and making a plan can really pay off later on.
Absolutely.
So for you, our listener, I want you to think about what quality of life means to you in retirement and how are you going to fund that life? How are you going to make sure you can enjoy your retirement years without having to worry about healthcare costs derailing everything? It's something important to consider as you keep planning for your future. Thanks for joining us for this deep dive. See you next time.